Hey everybody, Alan Weber here from the Mayor's office, late afternoon on a Thursday. I thought I would give you a briefing on some of the things I heard today. It's a regular weekly call that mayors around the country are invited to participate in, and I wanted to review what I heard so you know what I know about where we are as a country and as a city dealing with COVID-19. But before I get to a situation report from around the country, I thought I would first tell you the news of the day. Start out with a piece of data. As I think you may remember, yesterday Santa Fe County had 2 new cases. The day before that we had 0. The day before that 1. The day before that 1. The day before that 2. As of today, we had 1 new case. So we're now at 79 cases, Santa Fe County. Fortunately, thankfully, we've had 0 deaths in Santa Fe County. The state now is up to apparently a total of 44 deaths, sadly, and total cases for New Mexico, 1,597. New cases for the state today, 116. We know from looking at the map of New Mexico and the county-by-county data, there are some hot spots in New Mexico. We, thankfully, gratefully, are not one of them. A lot of it's localized in the northwest corner of the state. The Department of Health and Public Health experts tell us a lot of that may have to do with the Navajo Nation and people from the Native American community who are disproportionately being hit by COVID-19. Other parts of the country, it's the African American community. Here, I think the data are telling us a lot of it is the Native American community. So we ought to be thinking about ways as a community, as a city, as a part of the state where we are doing better, doing so well that when the governor did her press conference the other day, she singled out Santa Fe County for the exceptionally good work you all are doing, wearing masks, practicing social distancing, doing hand washing. All of that is why we only had 1 case today. If you go out, wear a mask. If you go out, wash your hands. When you get home, wash your hands. If you go out, make it count. Do an essential errand, food, or at a supermarket or a grocery, pharmacy, get your medicine, go to a doctor's appointment. If you want to get some exercise, do it safely, as my big brother Mark reminded me yesterday. That's a category unto itself, safe exercise. But I have to say, I heard today from some people in our community that our trails are jammed, which ordinarily would be a good thing, but under these circumstances, it's a warning sign. If you're using the trails, wear a mask. Don't get close to other people. Stay 6 feet apart. When you're running or jogging or walking fast, you could be having those little globules, whatever they are, those little droplets could be coming from you and unintentionally giving somebody else coronavirus. It is possible to be asymptomatic, have no signs, and yet have the virus. So we are doing well. You are doing well. Keep it going. Don't lose focus. Don't lose discipline. Please keep these numbers low. 2 yesterday, 1 today. Let's hope we get 0 tomorrow. The more we can reduce the incidence of the spread, the social spread of the coronavirus, the more we can see that the peak is coming. We'll get beyond it. We'll be on the other side of the public health emergency. Then we can turn, pivot, and address the other issues, the economic issues, the social issues, bringing our economy back to life. Right now we are in a bit of a self-induced medical economic coma. I was just on a call with some of our hotel and small business people, our restaurant people, they're hurting. They are applying for those SBA loans, Small Business Administration loans. All the money, the billions of dollars that the federal government put out there for small loans, small business loans, they've all been taken. So now we've got to go back to Washington, D.C. and let our leaders on Capitol Hill know we need another infusion of money. And frankly, city governments need them too. The last round that the federal government passed, there was no help for cities under 500,000 people. That means Santa Fe and most of the cities in New Mexico were left without any help from Washington, D.C. So we need help as businesses, as nonprofits, as individuals, people looking for unemployment benefits, for small business loans. This is a crisis like we've never seen before. It is a steep nosedive of the economic situation, and it will continue until we beat the public health crisis. We've got to solve for one thing at a time. Now let me bring you up to date on what I heard on this call with about 250 mayors around the country. It was pretty interesting because the first speaker we got a chance to spend some time with, virtually of course, was Bill Gates. And Bill Gates was somebody who 3 years ago or more gave a talk at the TED conference about how susceptible as a world, as a global entity, as a global community, how susceptible we all were to a pandemic. Well, 3 years later, here we are. He made a few really interesting points, and then I'll get into some of the other speakers that we heard from. He said, we are in a completely novel situation. There has been an exponential spread of the coronavirus. April is likely to be the peak month for deaths in the United States, but social distancing and more testing are our tools to get on the other side of this, because just as we've seen an exponential spread, we can see an exponential decline if we practice social distancing, increase the testing, and then discover who's been passing the disease on, do what's called contact tracing, and work backward to find people who might be coming down with the coronavirus. We need better testing, he said. Excuse me. We need tests that come back with results sooner than 24 hours. Excuse me. There is now a self-swab, so home testing can be done starting in the month of May, and probably a vaccine sometime in the fall of 2021. But beware, Bill Gates said, if there is a decline simply due to good weather and people getting outdoors and still practicing social distancing outdoors, that strong seasonal decline may be a false signal where we'd get overconfident and then see a spike come back. So beware of a summer decline that leads to a fall increase. One of our briefers is a public health expert from Johns Hopkins University. He said there's signs of peaking of the disease in the U.S. because social distancing is working. That's what's happening in Santa Fe County. Social distancing is working. But if we relax our discipline and our focus, it will spike again. He's worried about nursing homes, something we should all be concerned about. There are something like 2,500 nursing homes in the United States that have been affected by the coronavirus, and 3,800 deaths in nursing homes alone. In New York City, in 1 month, just to get a sense of the scale and the power, the evil power of the virus, in New York City, in 1 month, there were 10,300 deaths. So we can't take this for granted. We can't relax our discipline. We've got to stay focused on beating the coronavirus. The way to do it: test widely, isolate anyone who's infected, do the tracing of contacts, quarantine those people for 14 days, and then test again. Test anyone with a symptom. And I think it's to the governor's credit that New Mexico ranks in the top 10 states per capita, right around 4, 5, 6 tests per capita. We are way up there, and that is the single most important tool along with social distancing. This gentleman from Johns Hopkins said, even when we are on the other side, we begin to get to a policy for reopening, we are going to still change how we work. We'll still work at a distance. We'll have 6 feet between us. We'll wear masks. We will have video conferencing. We'll change how we travel. Airplanes will probably be severely regulated so that we keep people at a distance. We're not packed into airplanes. And we will change public spaces. There will be more spacing, more hand sanitizers in all public spacing. What are the key variables for people who need help? This is public policy we should all be talking about as we get deeper into dealing with the after effects, the secondary effects of the coronavirus. Access to care for everyone. How to get everybody tested. Access to services for everyone. Food and medicine. Access to information. Rumor control is critical. There's a lot of misinformation, bad information, and rumors spread across the internet. We need only solid facts, real information that we can share and count on. And then we need to have support for our low-wage employees. These are people who are not making a lot of money, but they're continuing to keep the economy going. These are the folks who are the everyday, hardworking, blue-collar heroes of this coronavirus crisis, and they need our support. The last word he left us with was solidarity. We are all in this together. We're going to see it through together. We are a community, whether we're talking about Santa Fe County, New Mexico, or the country. Now, there is a lot of interest on the topic of when and how we might begin to get to some reopenings. And I thought I would just share with you what the governor of California has put out. California, as you know, was one of the early states that had to come to terms with coronavirus. And Gavin Newsom, the governor over there, has identified 6 areas that he thinks are critical for his state when they look at changing from purely trying to break the back of the coronavirus to thinking about some kind of a very slow, gradual reopening. And I wanted to share them because I don't think we can jump the gun. We haven't got this thing licked yet, but it's okay to talk about how we will move forward because we're not going to be here in this current situation forever. Next month will look very different from this month. The month after that will look different. We got to keep our eyes on the prize, which is to stay healthy, stay safe, and stay at home. But as we think about the evolution of our journey through this public health crisis, this is what the governor of California has shared. Number 1, expanding testing. That is absolutely required. And that's where our governor has done such a great job. More testing for more people everywhere across the state. Protect high-risk groups, particularly seniors and people in vulnerable situations like nursing homes. I mentioned earlier the number of people in nursing homes who have died or gotten sick. It's one of the tinderboxes that we need to all pay attention to. Ensuring hospitals have enough beds and supplies to care for patients. Here again, we've been very fortunate in New Mexico. I think Christus has 2, 3, maybe 4 people in the hospital right now, 2 or 3 of them on ventilators, but we haven't been overwhelmed by cases because we're staying focused on social distancing, hand washing, wearing masks, keeping that 6-foot distance. The ability of treatment to begin to get better. This is some sort of vaccine or more science coming to our aid. Right now, there is nothing that is clinically approved. We will see over time more testing, more medicine. Ability of schools and businesses to support physical distancing. If we go back to all of us congregating in parking lots at big box stores or elsewhere, we're going to see a spike. So we've got to keep that discipline in businesses and schools so we don't start the spread all over again. And then finally, the ability to decide when we have to reinstitute stay-at-home orders if we get overconfident, if we lose our focus and that spike happens. There will have to be a second round of stay-at-home orders, wear masks, practice social distancing. But right now, we're nowhere near that list of items that the governor mentioned. So for all of us here in Santa Fe County, the city of Santa Fe, and in northern New Mexico, this is the time to stay the course, to stay safe, to stay healthy, and to stay at home unless you have an essential trip to take to the supermarket, a grocery store, a pharmacy, a doctor's appointment. And the other is, if you are going to a park or a neighborhood exercise area, a trail, stay safe there too. Don't let down your guard. When you're out in public, you are at risk. When you are at home, you're not stuck at home, you're safe at home. And what we want to see is day after day after day after day, numbers like these: 0, 1, 2, 1. Those are good numbers. Let's keep our focus and our discipline. Let's stay home. Let's stay safe. Let's wash our hands. If you go out, wear a mask. Practice social distancing. It is working. It's working for all of us. So keep with it. I'll bring you some more information tomorrow, some more data, some more advice from experts. Till then, please stay safe. Please stay healthy. Please take care of yourself and your family. Take care of each other by respecting the distance that we all need to keep to show how much we care about each other. Thank you for watching, and I will see you again tomorrow.